Hello, my name's Dr. Tina Ray and I'm an educational and child psychologist. Today I'm going to be talking to you about eating disorders. This is number 18 in my series of 20 sessions for teens and tweens, which aim at really promoting your well-being and mental health overall. This is a really tricky subject for many of us and one which I think we need to focus on, and you may need to access some additional information apart from this little introduction today. But I'm hoping that this will give you perhaps just a good basic understanding as to what eating disorders look like, how they manifest themselves, and the kinds of things you can do if you're worried or concerned about your eating behaviours or a friend's eating behaviours. A quick question to you at the outset. Have you ever thought yourself you needed to stop eating to lose some weight, or eating too much because you felt lonely or unhappy? And many of us would answer yes, probably, to both of those questions. And if that is true for you, then obviously what you need to know, what's important to know, is that you're not alone in this. And it's okay and good to admit it and not try to hide it. What is actually difficult for us is when we try to hide it and we don't get the help that we need as soon as we need it. And many children and young people do have difficulties with their eating styles, and some of these can sadly become very, very serious. So it's really important to understand more about what these difficulties are and how to recognise them if you or a friend have a problem. A real must do, as I said earlier, is that you must go and seek help and support as soon as you think there is an issue or a problem and you're concerned. So the different types of eating disorders, I think really these are probably the most common and the ones that people would talk about or you'll see talked about in the media or on the TV, etc. Anorexia, again, a serious mental health illness where people keep a low body weight by dieting, vomiting, using laxatives, or really excessively exercising. And the problem is for the anorexic child, young person, or adult, they tend to see themselves as bigger than they are, so they don't think they need to gain any weight. And people with anorexia, like most eating disorders, very often have low self-esteem, sadly, and low levels of confidence. Bulimia is a different kind of eating disorder, again, a serious mental health illness where the individual will eat lots and lots of food in any one given time. So very, far too much food. And then they will vomit. So they're binging and then vomiting. Binge eating disorder, similarly, is when they will do this on a regular basis. And again, it's linked to a loss of control. Emotional overeating, it really occurs when we eat too much food, a huge amount of food, because we're experiencing negative emotions. We're feeling down, stressed, anxious. And it's not really about being hungry, physical hunger. It's about feeling over emotional. And it's a way of actually trying to cope with these feelings and emotions that seem overwhelming at the time. Other eating disorders include pica, which is eating inedible items, rumination disorder, where you regurgitate food, or night eating syndrome, where you eat far too much, and sadly, Prader-Willi syndrome, where you may never feel entirely full. And selective eating disorder, obviously food phobia, being frightened of specific foodstuffs. So these are all very, very serious mental health issues. And what I really want for children and young people is to actually increase their knowledge of them, but also to point them in the right direction so that if they have any concerns, they get help as soon as possible. We don't really know what causes them, these eating disorders, for certain. Like many mental health illnesses, it's a complex set of different factors that will cause this kind of difficulty for an individual. And it's really difficult sometimes to find one single overriding reason. But usually people who have problems with eating, have eating disorders, often use food and the control of food to compensate for feelings and emotions that may otherwise seem overwhelming to them. They can't express or talk about them. Sometimes it's because they need to feel in control, and losing weight can make us feel very in control. It's something we can control even if we can't control other things in our lives. Some people may have been unhappy or anxious for a long time. It might show itself through eating. Sometimes when we go through puberty, this can be a trigger, and it may result in anorexia because this reverses some of the physical changes that we experience when we enter puberty. For some children, young people, this can be a way of putting off going through puberty in their minds. Sometimes depression is a trigger, a way of coping with depression and anxiety, low self-esteem. And sometimes it's simply this notion that young people find it difficult sometimes to really understand or unpick the images that they see on social media, which idealizes being thin and so-called beautiful, this notion of the perfect human being, the perfect body. And they'll reduce their food intake in order to try and resemble some of that. They want to look like the skinny models that they see most of the time when they are accessing this stuff online. Why is it important not to ignore this problem? Well, for some, dieting, binging, purging may begin as a way to cope with painful emotions and to feel in control. But ultimately, these behaviours will damage a person's physical, emotional health and their self-esteem, their sense of competence and control. I can't overemphasize how important this is. These are very, very serious problems. So getting help as soon as possible is absolutely vital. Talking to that trusted adult, the school counsellor, your learning mentor, your inclusion manager, your Senko, your parent carer, someone in your life who you know can help you and support you go and access the right kind of help via your GP. Reading up on eating disorders can help, and speaking to people that you trust, finding out a wee bit more so that you can actually understand and unpick what's really going on. And also, I think what's really sometimes very important is to read some real life stories to see how other people have coped successfully, because like many mental health issues and disorders, these things can be overcome with the right kind of help and support. I think it's important to be honest with ourselves as well, and to those close to you, about what you are or are not eating. So sometimes keeping a food diary can help us just to highlight what's going on and see if there are any connections between when you eat and how you feel when you eat, and vice versa. I think it's important not to punish yourself or give yourself a hard time about how much you eat or how much you weigh. And sometimes I think we need to stop lingering a wee bit too much in front of the mirror, because spending longer than we need to be looking in the mirror only adds to any insecurities, and we can become quite obsessive about that visual image that we're seeing when we look in the mirror. So we've got to be very disciplined about that. It's difficult. It's not easy to do. It takes a lot of resilience and guts to do it, and support from other people. And don't worry if you are lingering in front of the mirror too much at the moment. Please, though, talk about it to a trusted adult. Try to avoid websites that encourage starvation or purging, okay? This is really important because these are damaging. And sometimes the people who access and use these sites will encourage you to take on their bad, unhealthy habits. And they are unhealthy habits. They're not good for anybody. Ask for help from your doctor and talk about it with friends and family who care. Your doctor may refer you to a specialist counsellor, psychiatrist, or psychologist, and that's fine. It's okay. What's not okay is that you don't seek the help that you need. Hopeful message here, of course, is that recovery is entirely possible. Eating disorders are serious illnesses, but with the right treatment, children and young people can and do recover. So I hope that this has been helpful. And please, please, whatever you do, stop, pause and reflect. Think about the way in which you engage with food at the moment, what you do, how you eat, whether or not you're worried about this. It may not be a problem for you, which is great. And if it is, it's okay. What's not okay is that you don't go and access help. You don't talk about it to people who can help you. So hopefully this will be useful, and it may be something you want to consider in a bit more depth and talk to friends and obviously teachers in your school about. But please, please, please access help if you think there are any issues for you. And I hope you'll join me next time. And thanks very much for listening. And I hope this was useful.